Okay, I'm back to do my tracheotomy care video. I have my supplies still on my bedside manner. In this situation, I would have left the patient's room and came back. Knock again. Okay, Mr. Teddy, I'm back to do some tracheotomy care. My name is Brianna. I'm taking care of you. I'm going to perform some hand hygiene. I'm going to be doing some tracheotomy care for you. Just cleansing off your trach and making sure that everything's good. Did you have any questions for me? And once again, do you present with any signs of any allergies or anything? Just double checking your band once again to make sure everything's intact. Just verifying your name and date of birth. Okay. Now that I have my tracheotomy care kit, I will open it up. The bedside table, take off the label. I've already performed my hand hygiene. I will open up my sterile gloving. I will dye my non-sterile hand with my sterile gloves. These gloves have been used before for other videos, so it may take me a second. In theory, in the hospital, this will be performed properly. Non-dominant hand glove. Using a dominant hand, I will pour my saline solution back into my basin. I'll be using this for cleansing. This will be my saline solution into my basin with my non-dominant hand. I will then pre-moisten my cotton swabs and my cotton tips to cleanse the area. Okay, Mr. Teddy, I will then have this laid down for you. Do you catch any drainage or anything in the hospital setting? Still using sterile technique, only touching with 2 fingers. I would have removing the stroma to check and identify. I'll lower the bedside rail for my patient to make it more accessible for me. I will identify and measure the color, odor, any redness, any swelling, any consistencies, the amount of anything I see on the stroma. Disregard that and throw it into the trash receptacle as well. And then I will use my dominant hand to put on more gloves. I don't have all the equipment for the tracheotomy care, but in the hospital setting, after I remove the stroma, I'll remove the cannula, remove the oxygen mask first to access the cannula and the stroma and everything. I will untie the ties to be able to see the tracheotomy. I will remove that. I will also check that for anything. Now that that is removed, I will take it out with the curvature technique, making sure that it comes out smoothly for the patient, don't experience any pain or any discomfort. And then I will gently insert the new cannula back into, once all that has been put into the trash receptacle, I will gently insert the new cannula back down at the curvature angle. Okay, and now that I have my already moistened cotton swabs, I'll use that to cleanse this area. As you can see, Mr. Teddy already has a bow tie on. That would, in this situation, be my trachea care tie that keeps everything in place. I will use that to cleanse the area. Disregard everything that I'm using into the trash bin receptacle. I will use the gauze. And killing in a circular motion, going outward, cleansing the area, making sure that everything is okay. I have my moistened gauze, disregarding that. Once everything is clean, I will then use my gauze to also pat the area. Make sure that everything is clean and dry around that area. You don't want your patient having any moistness. Once I'm done with that, I will also disregard that. Now that I have everything cleansed on that, I will stabilize my trachea tube with I also have my pipe cleaners to cleanse inside the trachea. As I was cleaning it, I used to clean the area. I use the gauze and the already moistened Q-tip, but I can also use this to cleanse out the area to get any of the mucus buildup out. And everything. When I was done with these, I can also put these into the trash can receptacle. I've already used these equipment for previous videos, but in the hospital setting, everything will be fresh. This will be a fresh tracheotomy kit. I would then use my dominant hands to tie, using 2 fingers to tie in my tracheotomy, keeping it in place. That the patient is already cleansed and taken proper care of before. The old ties would already have been disregarded. This, as I was using as the old tie, would have been disregarded and put into the trash can. Everything was placed into the trash receptacle. I would then take off my gloves. Now that he's good, Mr. There, everything's cleansed with you with your tracheotomy. We've cleansed up the area. We performed suctioning. Everything was taken care of. Do you have any more questions for me? I would then lower the bed back down, put the guardrails back up, make sure that the patient has the call light, disregard this into the trash bin as well. I perform hand hygiene. And then I would also take the mouth sounds once again, and the bowel sounds to make sure that everything is proper after me removing everything. S1 and S2 are heard, no signs of any murmurs, no signs of S3 or S4. Also take the bowel sounds in the 4 quadrants. Once the tracheotomy has been cleaned, the mask would have been placed back on there. We want to lower back the pulse, oxygen levels back to normal. They were hyperactive at first to make sure the patient was receiving enough oxygen while we're taking it on and off. We'll make sure it's back to regular so the patient is able to breathe properly without having too much oxygen saturation. The patient is back in the comfortable position. And if you have any questions for me, Mr. Teddy, you have your call light, you're in a comfortable position, your trachea is clean, we've informed care on you, everything should be in proper place, your oxygen levels, everything has been turned off on the walls. Go. The regulator has been turned off, which will be behind the bed. The respirations will be checked, the SpO2 will be checked again, making sure that everything was in normal standards. And we've completed our tracheotomy care on our patient.